I'm here in San Francisco at the Marine Memorial Hotel with Raj Chopra, the CEO of a new biotech that is, depending on when you're seeing this, has either just launched or launched fairly recently, called Aethon. And Raj, tell us a little bit about what Aethon is all about and how it came to be.
So Aethon is an oncology therapeutics company which is created bispecific antibodies that can be used in combination with targeted covalent inhibitors to eradicate drug-resistant cancer cells. And this is really based on the technology that's come from Shoei Keida and Ben Neal's lab at NYU, which really showed that their observations showed that when these targeted covalent inhibitors bind an oncogenic target such as KRAS, the targeted protein is processed in the cytoplasm, endoplasmic reticulum, and then presented on the cell surface on major histocompatibility class 1 proteins. And this acts as a beacon for the immune system to recognize specifically cancer cells that have been treated with this drug. So think of it as a two-punch approach to cancer. First, the drug itself attacks and kills the cancer cells, but any persister cells or resistant cells to the small molecule are then eradicated by these antibodies that we've created by design.
Interesting. So how is this, what's the major innovation here that makes this different than sort of the other kinds of immunotherapies?
So the observation is that this is essentially unifying small molecule approaches with bispecific antibody approaches.
So you get the best of both worlds.
So you get the best of both worlds. And it works that even if you get resistance to the drug, that is the key observation, you still present these peptides on the surface. So it acts as a beacon for the immune system. And now you can come in and design antibodies to this specific peptide or drug conjugate, which we call a hapten, which is found in the MHC pocket. And you specifically, we've designed antibodies which really recognize this drug conjugate in the context of this MHC complex.
How broad is the potential for this?
Well, the potential is broad because these small molecules that you can discover do not necessarily have to be inhibitory. All you need to have is irreversible binders to any portion of a tumor-causing protein in the cell, and they will then be presented on the surface of the cell for attack by the immune system. So the potential is very broad. Initially, we're obviously going for targeted covalent inhibitors, such as those covalent inhibitors that target RAS, EGFR, BTK, for example. But ultimately, in the mid to longer term, we are going to develop our own chemistry with our own proprietary antibodies for intracellular drivers of cancer.
So this could be across the board in cancer care?
It could actually be a major impact.
That.
Yes, because any cancer driving gene that has got ability that we can target with chemistry in an irreversible manner will be presented on the surface.
So tell me a little bit about the company. You said it came out of this work at NYU, and they're part of the founding too, or
yes, they're the founders, and most interestingly, NYU is actually also invested in the Series A with Appletree as the sole venture capital partner in this context.
And
so the Series A, yes, I am as well. So we've got a Series A of 30 million, and essentially we started talking to the founders at NYU about a year ago, and together we collaboratively designed further experiments. Actually, the most interesting thing is that we now understand the mechanism of action of these antibodies based on structural biology. And this has really led to the formation of Aethon, which really occurred on the 16th of December, and we're launching it on Monday, the 9th of January.
What are the next steps for this technology in terms of validating it and seeing, if it will work in real patients?
So the next steps is really designing different formats of these bispecific antibodies to really see which is the most optimal to activate the immune system without causing some of the side effects that one sees with bispecific antibodies that activate T cells, for example. And we're very much working on a number of formats, and these are actually being tested in vivo in specific resistance mouse models. And these experiments are ongoing. We hope to complete these by the third quarter of this year in the company, and that hopefully will give us leads for drug candidate nomination in 2024, and we hope to be in the clinic by 2025.
Perfect. Let's talk a little more broadly about trends, I guess, in biotech. We're all here to sort of talk about what's going to happen in 2023. Yeah. What do you think are kind of the most important pharma R&D trends that we're looking towards in the next year?
So obviously there's been a huge explosion, as you know, of discoveries in cancer drug discovery particularly. We've had small molecule inhibitors. We've now had targeted protein degradation. And I was actually a founder of the company Monte Rosa out of Boston. And then we've got a revolution in use of antibodies, both bispecific antibodies. We've just seen Genentech register a bispecific antibody in lymphoma. And we've also seen antibody drug conjugates coming through. What I think this is yet another pillar of the armamentarium against cancer. Here, essentially what we're doing is to eradicate resistant cells to small molecules, essentially using the two-step approach that I described. So it really complements the approaches and the novel approaches that are taking place as we speak.
These different ways to attack cancer, to approach cancer, especially these newer modalities. Is it, you said it complements. So is this going to be a situation where we just want the arsenal to be as big as possible so that you'd be able to pick the right treatment for the right disease? Or could something like this sort of surpass or
in some ways it could surpass some of our current approaches, partly because we're creating antibodies by design. We actually can select the target in the cell, which is driving the cancer. And if we use it early enough, because these peptides, these beacons are presented, even when the cell gets resistance to these drugs, then we think in some ways you can prevent the emergence of resistance, which is the holy grail of cancer, which is really preempting evolution and tumor heterogeneity.
Because that's what makes, one of the things that makes oncology care so difficult, and especially like precision medicine, is because some people are just resistant and everyone's
absolutely.
Yeah.
And so we will, by design, really create antibodies in different contexts and drivers of cancer. And so it really is taking precision medicine to the next step.
Is your plan for this company to ultimately license this to a larger company for manufacturing and things like that, or would that sort of depend on how things go?
So, as you may understand, there is already considerable interest,
I'm sure,
from companies that have got targeted covalent inhibitors. I can't say more, but we are starting discussions there. But ultimately, we see this company as developing its own chemistry and its own proprietary antibodies as well. But obviously, we will start with registered compounds such as sotorasib or omicertinib, which targets EGFR, and then move beyond that.
Right, because with those, you don't have to do as much of the validation, because the parts of it are already...
Exactly, there's a validation that's already taken place. There's precedence in the clinic, and there's proof of concept there. And so I think in that context, that's exactly where we'll start. And we will start in two positions where you develop resistance to these drugs or preempt resistance by measuring emergence of resistance using liquid biopsies. And as soon as you start seeing evidence of molecular relapse, you can come in with these antibodies and treat.
Got it. Well, thank you so much for sharing this news with us, and I hope you enjoy the rest of the week.
Great. Thanks for your time.